Okay, good evening. This is Module 6 assignment regarding major questions in this assignment regard medication noncompliance, reasons for noncompliance, and strategies to help patients and clients maintain medication compliance. This topic kind of hits home with me a little bit because I'm not the greatest at taking my medication as prescribed. While I was working on this, finalizing everything today, I realized that it's now been 4 days since I've taken my anti-anxiety medication, mainly because I'm out of my routine, because I normally do it at lunchtime, and I have it at work, and I've been off work for 4 days. So that's where that occurred there. It's interesting to read about research and things that have been done with regards to medication compliance and noncompliance for patients for various conditions and situations. Mainly, noncompliance, the definition of noncompliance is basically not adhering to the instructions or requirements for any sort of treatment, in this case treatment, for a condition. So not taking medication as prescribed, taking more than the prescribed amount of medication, not taking enough, not following through and getting prescriptions filled, and so forth. The main reasons that I found in doing research that individuals are not necessarily compliant with taking their medication are usually those that I've listed, either taking a lower dose, taking a higher dose, which is still taking the medication but not at the prescribed amount, taking doses outside of the prescribed times. So if it's a medication that you're supposed to take at night and you're taking it during the day, and that sort of thing. But one thing I guess I never really realized that would fall under non-compliance for medication is the financial aspect, or not being able to afford the medication, whether it's due to it not being covered with insurance or Medicare or Medicaid, or just that the fact that even if it is covered, an individual doesn't have the financial means of meeting even those co-pays if they are required to still pay for that medication. In that case, obviously, we're looking at some pretty concerning situations, because then they are most likely also not going to follow through with rechecks with their physician or with their treatment provider due to the fact that they probably wouldn't be able to afford those co-pays either. And so there's the concern as to whether or not a condition would either go ignored completely or just be one of those things that an individual sees as not a priority in their lifestyle, given everything else that they have to pay for or that they're required to pay for. Individuals that either do not qualify for Medicare or Medicaid, or cannot afford insurance, even if it is insurance provided under the Affordable Care Act, will go without medication, and so then therefore it's difficult for them to be able to see any sort of physician or doctor or dentist or anything for any concern because of financial means, and so they just kind of quote unquote deal with it, which then leads to them going to the emergency room or urgent care, and then kind of completely defeating the entire purpose of that by having to then owe those facilities. Another thing that I think that some people don't necessarily think of with medication noncompliance, and it was discussed in one of our assignments for this module, is the fact that an individual just feels better. They're on their medication, they feel like they're doing better, and so they don't necessarily feel that they need to take that medication anymore. Again, as I mentioned in the discussion, I have fallen prey to that a few times. My anti-anxiety medication that I am currently have not been taking for the 4 days, I do not have, I have very, very minimal side effects of not taking the medication. Very, very minimal withdrawal of not taking, just completely stopping the medication. Whereas if it is my antidepressant and I go more than 2 days, it is a complete 180 from my mood, and it is scary. It is a lot of screaming, a lot of crying. And kind of places me in a very dangerous situation with my thought processes and that sort of thing. And so even though I know that I can go, I'm sorry, not that I can go, even though I know that my body and my brain will react in those manners and put me in a very precarious situation if I do not take that medication, sometimes I just don't want to take it because I don't want to take that medication for the rest of my life. So, how am I going to know if I don't need it unless I stop taking it? And I know in 2 to 3 days whether or not I need to start taking it again. Luckily, when I do start taking it again, it kicks in fairly quickly. But then there's still that period of time that's concerning for those that are around me. So I think that really plays a big part in part of what is considered a non-compliant situation with regards to medication. Again, what could come from an individual not complying with any sort of medication regimen or any sort of treatment recommendation, again, could be things very minimal is, so maybe they aren't able to take that medication that helps with those cluster headaches. Or maybe it's something pretty serious that ends up constantly landing them in the ER for treatment for that period of time. And then they just kind of hold on to that treatment until that wears off and then go back to the ER because they can't go to the doctor or afford that medication that is able to maintain that stability. Then there's, of course, also the concern that individuals who do not follow their treatment regimen, their treatment recommendation, or their prescription recommendations, who succumb to their situation. I think here in my research, it says that the World Health Organization reported that 10 to 25% of hospital and nursing home admissions were a result of patient noncompliance. So even though the individual might be thinking at that time that this isn't something that they can afford, they'll just deal with it. And if something pops up, they will go to the hospital. They will go to the emergency room or urgent care. It really kind of doesn't do any justice to wait because now, the cost of those use of facilities in that time has just also meant the same period the same amount that would have cost if the individual was compliant with their medication. And looking at strategies or situations that can be used to assist individuals in becoming more compliant with their medication, I think some of that falls on the doctors. As I mentioned in the discussion, there's only so much that you can do to make sure an individual is going to take their medication. They do have to continue to come back for their appointments. And, you do have to trust that they're telling you the truth if they say that they are taking that medication. I know in Michigan we have a prescription system. I'm sure many other states have that as well, that you can look up to see whether or not individuals are at least filling that medication. Outside of that, once that medication's in their hands, we don't necessarily know if they're being compliant with it unless they're filling it either not as frequently as they should or too frequently for that matter. But outside of that, they could be filling it on time and not necessarily taking it as required. I was able to read something with regards to electronic pill boxes, which I thought was very interesting as well. So these pill boxes send text messages to remind people to take their medication. I do know that there are also apps that, people can download on their phones and set to send reminders that tell them that they need to take that medication. People use alarms on their phones to tell them to take their medications. I've tried the app and alarm thing before, and really, when it comes down to it, I just, I found it easier with being able to know that I need to take my anti-anxiety medication during my lunch, and my antidepressant and my birth control are taken at night, and so they sit by my bed. My anti-anxiety medications are kept at work, with the exceptions of some that are kept on my person for when I am not at work, obviously. So it's finding those things that work for certain individuals. The other thing is again, that needs to be taken into consideration is the level of honesty. I'm very honest with my psychiatrist when I go for my appointments. If he says, hey, so how have you been doing? Have you been missing any? And I'll tell him, yeah, I missed a couple. I'm going to go see him here in a week and a half or so. And I'll tell him, yeah, over my 4 days off at Christmas, I did not take my anti-anxiety medication. It was out of routine for me, and now I need to know that I need to get that figured out. While weekends, are obviously common, I'm not at work. I'm pretty good about taking my medication on the weekends. But when I'm on like a 4-day break because of a holiday from work and actually decompress from work and step back from work, which is very unusual for me, that entire routine in and of itself kind of goes down the drain. And it's not possible for me right now at 6:30 at night to take my anti-anxiety medication, because it will then keep me from being able to sleep. So then my antidepressant, which helps me sleep, would not be as effective. And then, tomorrow will just be horrific anyway. So looking at, making sure that adherence is at some sort of level and some sort of understanding for each individual patient. Again, I think places a lot more onto the doctor or the physician to make sure that that is occurring. But I think that also that there needs to be some step up with some doctors to look at other opportunities or options for individuals who maybe cannot afford that medication if they're on Medicaid or Medicare. Sometimes those medications, even with being covered by Medicaid or Medicare, are ridiculously their cost is unbelievable. And these are individuals, especially if they're on Medicare, these are individuals that can't necessarily afford something, like a medication that's going to cost them $100 or $120 a month. So looking at options for helping to decrease those, talking to vendors, talking to pharmaceutical companies to see what they can do to assist their own patients, and that sort of thing would be beneficial in increasing that medication compliance. But overall, it's on a person by person, case by case basis, I think, with regards to compliance and adherence to medical requirements or treatments. You would need to just be diligent about making sure that you talk with your client and your patient about, the concerns if they do not take the medication, or if they do take the medication and then they go some days without taking the medication, any sort of withdrawal symptoms, any sort of concerns that need to be done there. So that they just don't, take it upon themselves to make those decisions. They are fully aware of any concerns that you would have about that medication.